So hi, my name is Priya. I'm a recent graduate from the University of Chicago. I got a bachelor's in public policy with the focus on health and human rights, and I really enjoy traveling, so the experiences that I've been able to have with the center, at the good fortune of the Center of Global Health and the Human Rights Department, has been really amazing. On a sandy lawn. Two different projects. The first project was working with an OBGYN physician at Groote Hospital in Cape Town. So what I did there was kind of had my own study, which I was able to design independently and administer by interviewing low-income cervical cancer patients to understand the kind of different barriers of access that they faced throughout the process of first being diagnosed all the way up to the point that they got treatment. So understanding how they accessed different health facilities, how they accessed screening, what were their prior knowledge and attitudes towards both cervical cancer, and pap smear screening, and really understanding the kind of context that they're coming from, the familial constraints that they have, or the different things that had been going on in their lives at the time that they were diagnosed with cervical cancer. The other thing I did was work for Aortic, which is a nonprofit on the African continent that deals with cancer advocacy and cancer policy. So what I did for them really was to develop a questionnaire to do an environmental scan of the different kinds of cancer advocacy nonprofits and programs that were in the African continent, like what have people been doing and what strategies have been successful, and that's going to be used for a workshop at the Aortic conference this November. And I also made a preliminary survey for them to use to assess the status of cancer registries on the African continent. Around the time that I was given the Human Rights Grant, which allowed me to fund my travel and the ability to do this independent research and work, I also studied abroad in Cape Town, South Africa, and being there for 3 months, I really fell in love with the place, but I also saw that it's a very nascent democracy, but it's also very nascent in terms of how it's dealing with a bunch of different issues, including health. So I was really fascinated by the way that disparities played out given the history of apartheid. And so in terms of looking for a human rights project, in terms of looking for some independent work that I could do, I knew I really wanted to come back to Cape Town. And so Dr. Olopade had a colleague that worked in Cape Town at Groote, and so I met my mentor that way, Professor Lynette Denny. I met her when I was studying abroad, and we were both really excited about the kind of opportunities that were there. So she was like, come back, and I was like, of course. And then, so after that, it was kind of history. I came back from studying abroad, and like 2 months later, booked a $2,000 ticket to go back, which was terrifying. In terms of preparation, well, there's two kinds of preparation, right? So like one in particular preparing for the projects, but also the other in terms of like preparing to go to a completely different place and living there for 3 months. So I was fortunate to have gone to South Africa and have lived in Cape Town for 2 months prior, so I kind of had a sense of the lay of the land and what to expect, but still living in a totally different place, came with its own challenges. Like, for example, I had to buy electricity at a grocery store, and I had no idea how to do that or that you could do that. But in terms of preparing for my projects, it was just a lot of reading. But reading can't really prepare you for what you actually end up encountering there. But a lot of what I did was to read up on cervical cancer, to read up on the effects of this policy that had been unsuccessfully implemented so far, and to kind of speak with my mentor there to get a sense of the kind of work that I'd be doing. But to be honest, I didn't really fully grasp what my project would be or what it would entail until I got on the ground and started doing it. You'd still enjoy it with your foot on. My typical day, so if I was working on this study, I would wake up around 6 or 7. I would go to the hospital. I would sit in on rounds with them, so they would, similar to how we have breast conference here, they reviewed gynecologic OBGYN patients in a similar way with pathologists and surgeons, and with nurses to really just compare notes on the patient and to understand the different aspects of their cancer diagnosis. So that was the morning. So after the morning, it was clinic time, and during clinic, I kind of sat in the back of this really hectic clinic room, got to shadow, got to see doctors talking to patients, and it was a much different experience than how patients kind of interact with their doctors here, because there's usually like a big room of like 15 physicians and residents or whatnot, and the patients come into that room and that's where they're seen for their appointments. So a lot less private and a lot more hectic. So during that time, either when patients were waiting for their appointment or after their appointment, doctors would let me know that it was okay to interview them. So I'd take them aside to a separate room. I would interview them about their experiences, and these interviews took about like 30 to 45 minutes, and then after that the patient would either go to their appointment or they would be done and they would go home. And so once clinic was over, and that was around 12 or 1, I would say I would have interviewed about 3 to 4 patients if I'm lucky, and I would go home and kind of transcribe these interviews and enter in the data. So that would be my typical day if I worked on this study. If I was working at Aortic, my typical day was going to the office and really working independently on the projects that they had assigned me. I would like to thank the staff that I worked with at Montesquieu Hospital in Cape Town, particularly my mentor, Professor Lynette Denny. I also want to thank the community health workers that I worked with, Lulu and Ubuntu, the University of Chicago. I'd like to thank the Center for Global Health, and I'd like to thank the Department for Human Rights, because without their grant, there's no way I would have ever been able to go to South Africa.
Getting sentimental, said she wasn't going but she went still, like a gentleman to be gentle, with a Mecca double or betting pencil, all the boys are slag, the best you